Most people hear the words non-emergency medical transportation and think it's simply a ride to the doctor. But for thousands of Americans every single day, that ride is the difference between receiving life-saving treatment or going without it.
Dangerous delay. The News for JICA IE team has uncovered thousands of complaints filed over 3 years against a taxpayer-funded transportation company for Medicaid recipients.
Loved ones say their elderly family members have been left stranded while waiting to be taken to or from doctor's appointments. IE team investigator Ann Maxwell found out there has been little oversight of the program.
Imagine sitting in a wheelchair outside a medical office in the middle of summer. The minutes pass, 30 minutes, an hour, then 2, your ride never comes. Eventually the office closes, the staff leaves, family members begin calling, wondering where you are. Unfortunately, this isn't just a hypothetical scenario.
Stories are frightening. One woman told me her elderly father missed multiple appointments because the company failed to pick him up, at one point leaving him stranded in his wheelchair in the Jacksonville heat for 5 hours.
Across the country, patients have experienced missed pickups, hours-long delays, canceled trips, and appointments they never reached. Families have described elderly loved ones stranded outside medical facilities, missing critical treatments, and feeling completely helpless when transportation failed.
Renee Reynolds depended on to get her 84-year-old father to and from doctor's appointments. She says she never filed a complaint with the state, even though she experienced plenty of problems with the service, including rides that were late or never came at all.
Every time I called here, it was another 20 minutes, another 20 minutes. I mean, this went on for 3.5 hours. I was about to pull my hair out.
She says missed or late pickups left her scrambling, wasted doctor's time, and sometimes left her dad and his caretaker stranded outside of providers' offices.
And so they had run out of water, 98 degree heat, 5 hours. Somebody find.
She says she's called the company to complain, but it doesn't go anywhere.
You know, I don't get a case number. I don't ever get a call back to find out whatever happened to it or things they're going to do to change. Nothing. It's just a black hole.
This is why transportation isn't just a convenience. It's part of the healthcare system itself. Think about the patients who depend on these rides. A dialysis patient cannot simply skip today and make it up next week. A chemotherapy patient has treatment schedules carefully planned by physicians, and someone recovering from surgery needs follow-up care. A wound care patient may need regular treatment to prevent infection. For these individuals, getting to the appointment is every bit as important as the appointment itself.
One time that he was stuck outside the dentist's office for 3.5 hours, we managed to contact the fellow who had dropped him off, and we paid him like $60 or $80. It was, it was a pretty, to only go like 10 miles. It was a pretty good fee that we gave him, but we had no recourse.
When transportation breaks down, healthcare breaks down. Missed appointments can delay treatment. Delayed treatment can lead to emergency room visits. Hospitalizations increase. Medical costs rise. Most importantly, patients suffer. That's why great NEMT providers understand they're carrying much more than passengers. They're protecting continuity of care. They're reducing preventable hospital admissions. They're helping patients remain independent. They're giving families peace of mind.
That's what makes it especially frustrating is she lives in Houston, Texas, while her dad is in Jacksonville.
Professional NEMT drivers don't simply drive from point A to point B. They assist vulnerable passengers safely. They secure wheelchairs properly. They communicate with caregivers and medical facilities.
Feel so helpless. You know, especially when he's someplace and he can't get home.
Being 10 minutes late isn't just poor customer service. It could affect someone's health. Every successful trip means another patient received the care they needed. Every on-time pickup protects someone's treatment plan. Every safe ride strengthens the healthcare system. That's why NEMT should never be viewed as just transportation. It is one of the most important links in the entire continuum of care, because before a doctor can provide treatment, before a nurse can administer medication, before dialysis can begin, the patient has to get there. And that's why dependable non-emergency medical transportation isn't simply transportation. It's critical care in motion, safe, reliable, every ride, every time.